What were historical bladder control techniques? Imagine trying to manage bladder issues centuries ago with very limited tools and understanding. Early efforts focused mainly on containment rather than active control. The earliest known records, like the Ebers papyrus from around 1500 BC, show that people used absorbent materials such as cloth or pads to catch urine. These were basic solutions to prevent accidents but didn't influence how the bladder worked. As time went on, herbal and chemical remedies became popular, especially in the 18th and 19th centuries. Doctors experimented with ingredients like ergotamine, opium, and atropine. These substances had properties that could influence bladder activity, either by reducing overactivity or helping with retention. Hydrotherapy, which involved cold water baths and douches, was also used to stimulate or soothe the bladder mechanically. Surgical methods started to develop more significantly in the 19th and early 20th centuries. Early surgeries for bladder stones and urinary retention were often risky and crude. Over time, surgeons refined techniques like perineal lithotomy, which involved removing stones through an incision, and later introduced the suprapubic approach, which involved accessing the bladder through an incision in the abdomen. When it came to bladder control specifically, surgeons like Howard Kelly in the early 1900s began developing procedures to treat incontinence. Initially, these focused on repairing fistulas, but later they targeted stress urinary incontinence, especially after prostate surgery. Mechanical devices also played a role. In the 1600s, Wilhelm Hildenus created the first condom catheter using pig bladder, which was a simple external device to help men manage leakage. In the 1700s, devices like the perineal compression belt were introduced to apply external pressure and help keep urine in. The 20th century brought major innovations. The Foley catheter, introduced in 1929, revolutionized bladder management by providing a safe, sterile way to drain urine. Artificial sphincters and sling procedures were developed to help those with severe incontinence, especially after prostate surgery. These advancements laid the groundwork for modern bladder training techniques, which focus on behavioral strategies like scheduled voiding, pelvic floor exercises, and biofeedback. These methods aim to improve bladder capacity and control without surgery, building on the earlier mechanical and medicinal approaches. In essence, bladder control techniques have evolved from simple containment and herbal remedies to sophisticated surgical and mechanical solutions. Today, bladder training and lifestyle management are key parts of bladder health, especially for those recovering from bladder cancer or dealing with incontinence. Always remember, if you're facing bladder issues, consulting a healthcare professional is the best step to find the right treatment for your individual needs.